Features of dysplasia. These are the various dysplastic features: drop-shaped retiprosis, basal cell hyperplasia, irregular epithelial stratification, nuclear hyperchromatism, increased nuclear cytoplasmic ratio, increased normal and abnormal mitosis, dyskaryosis, karyomegaly, poikilocarcinosis, cellular pleomorphism, loss of polarity and disorientation, individual cell keratinization, and keratin pearl formation. The dysplastic features in cytology can be differentiated into two things: cellular alterations and architectural alterations. In cellular alterations, the nucleoli appears to be prominent and hyperchromatic. There can be nuclear pleomorphism, altered nuclear cytoplasmic ratio, increased mitotic activity inside the cell, abnormal mitosis, like abnormal shapes can be seen, multinucleated of cells. In architectural alterations, there is loss in polarity of basal cells, disordered maturation form of basal to squamous cells, increased cellular density, basal cell hyperplasia, dyskeratosis, bulbous retipex. The first feature of dysplasia is drop-shaped retiproxus. The retipex that are wider in the deeper portion than they are in the superficial portion, they appear in a drop-shaped appearance. Basal cell hyperplasia. Basal cell is a germ layer which undergoes constant proliferation. Hyperplasia occurs due to increase in the rate of mitotic activity. The development of basal layer can be several layer thick due to this hyperplasia. The third feature of dysplasia is irregular epithelial stratification. This is due to the apparent inability to properly differentiate and mature from basal cells to prickle cells to flattened keratinocytes, thus affecting the regular stratification pattern of a cell. The fourth dysplastic feature is nuclear hyperchromatism. The hyperchromatism means there is a development of excessive chromatin or excessive nuclear staining as a part of pathological process. The nuclei in the cells are darkly stained due to the increased DNA synthesis. The fifth dysplastic feature is increased nuclear to cytoplasmic ratio. The nucleus enlarges and occupies a greater part of the cell as compared to the cytoplasm. The normal ratio is 1:4 to 1:6. If any ratio exceeds more than this ratio, then there is an increased nuclear cytoplasmic ratio. The sixth feature of dysplasia is there is an increase in number of mitotic figures that can be seen in a cytological slide, or there can be abnormal mitotic figures that can be seen due to various abnormal mutations. Some of the abnormal mutations are X, Y, and K-shaped mutations that can be seen. These are the images that show the various types of regular mutation and regular mutation, and these are the cells that show irregular mutation in dysplastic features. Dyskaryosis is the seventh feature of dysplasia. It is the abnormal shape of the nucleus. It can be seen due to abnormal number and arrangement of chromatins inside the nucleus, which is one of the important features of dysplasia. Karyomegaly. Karyomegaly is the eighth dysplastic feature, which means large prominent nucleoli. It is the enlargement of nuclei due to increase in nuclear proteins or nuclear edema. Enlargement of eosinophilic nuclei may stand out like a golf ball. The nucleolus becomes prominent in cells are actively synchronized of proteins in major of rapidly growing malignant cells. Poikilocarcinosis. It is the formation of a cell with multiple nuclei, which can be seen in various dysplastic cells due to their abnormal mitosis inside the cells. The 10th dysplastic feature is cellular pleomorphism. Variation in the size and shape of the cells can be seen. The cells just take various forms due to defects in formation of protein formation in cytoskeleton, loss of desmosomes. The 11th dysplastic feature is loss of basal cell polarity and disorientation. The basal cells are not perpendicular to the epithelial connective tissue junction but are on an angle to the junction. This is due to the loss of desmosomal junction that normally unites the cell together due to defects in formation of newly dividing cells, breaking of junction by action of malignant enzymes in frankly malignant lesions. The 12th dysplastic feature is individual cell keratinization. It is the premature production of keratin within the cytoplasm of an individual cells or a group of cells. The last feature of dysplasia is keratin pearl formation. The desmosomal junctions are maintained and the polyhedral cells mature, thus forming keratin in the center of the epithelial nest, which appears to be rounded and pearl-shaped appearance. Thank you.